Congressman Ted Lieu. Sir, please take it away.
Thank you so much. This is Congressman Ted Lieu. I'm so honored so many of you have joined this telephone town hall. And today we're going to focus on health care, on the cuts in the big, ugly law to Medicaid, Medicare, as well as their Affordable Care Act. And I'm so honored we're joined today by three amazing speakers. And as was noted earlier, we're joined by Dr. Anish Mahajan, Chief Deputy Director of LA County Department of Public Health, and also Dr. Mitesh Popat, CEO of Venice Family Clinic, and Dr. Andrea Turner, CEO of Harbor-UCLA Medical Center. Before we get into the specifics of the devastating healthcare cuts, I do just want to explain why we're even doing this town hall right now and why we're in congressional recess. Literally because the Speaker of the House, Mike Johnson, let us go early because he didn't want us to vote on releasing the Jeffrey Epstein files. So it is remarkable that the House Republicans are engaged in this epic cover-up of massive proportions. I talked about the Epstein files during the Biden administration. I'm talking about them now. I believe they need to be released. We should be for full transparency, and we should not be protecting the legacy of Jeffrey Epstein or his pedophile clients. So we are now here today going to talk about the cuts to Medicare, Medicaid, and the ACA. The big, ugly bill had the largest amount of health care cuts in U.S. history. It's going to kick off 15 million people nationwide off of health care, and it's doing that. And you might want to ask, well, why would Republicans do that? Because they want to then reward billionaires and millionaires with massive tax breaks. That's essentially what their big, ugly law does. And we're going to have, again, three amazing speakers tell us about what the consequences are. I just want to let you know specifically what's going to happen in our district, which is a 36th Congressional District, California. Approximately 14,000 residents are essentially going to lose their health insurance under this big, ugly law. And then California statewide will see a $150 billion cut at least in federal funding for Medi-Cal, which is basically it's basically what we call Medicaid in California, Medi-Cal. And over 2 million Californians will lose health insurance. And so this is a very dramatic law that's going to affect many people in California. And you're going to hear from the speakers, Medicaid also funds a lot more than just health care. It is in so many aspects of society, and it is just really a very devastating law that we're trying to fight back against. Now, the silver lining to this is the Republicans tried to be devious, and they structured the Medicaid cuts to basically take place after next year's midterm elections. But then that gives us opportunity to say, well, look, hey, do you want to vote for the same Republican that voted for these deep cuts, or do you want to change the House so that we could stop these cuts? And so hopefully that's what we're going to be able to do. And again, we're joined by three terrific speakers who can answer your questions. And feel free also to ask questions on sort of basically any issue you feel like asking on. Today's town hall will be focused on healthcare, but if you want to, ask about, immigration, or you want to ask about democracy, all of that is totally fine. So now I'm going to introduce our first speaker, who is going to be Dr. Anish Mahajan, and he's the Chief Deputy Director at LA County Department of Public Health. The department has an operating budget of $1.6 billion and 5,000 employees. It is the largest local public health department in the United States. Prior to his role in public health, Dr. Mahajan was CEO and Chief Medical Officer at Harbor-UCLA Medical Center. And from 2012 through 2016, he was the Director of System Planning, Improvement, and Data Analytics for LA County Department of Health Services. He has had a huge amount of experience. And I do also want to note that he did serve at the federal level as well. In 2009, he was appointed by President Obama to serve as a White House Fellow in the Office of Management and Budget, where he was a special advisor to the OBM director on the lead-up and passage of the Affordable Care Act. So with that, Dr. Mahajan, if you want to go ahead and say a few words, and then I know you're happy to answer questions as well.
Yeah, thank you so much, Representative Lieu, for hosting this important town hall and for being a champion and a leader for protecting public health services. And I also want to thank all of you who are participating tonight and being engaged citizens who are here to help support us and ensure that LA County residents have the resources and opportunities they need for their optimal health and well-being. I'd like to take a few minutes just talk about the impacts of what Representative Lieu was talking about on public health services here in Los Angeles County. Public health is increasingly being seen as a public safety enterprise along the same lines as public safety responders. Like during emergencies and even every day, we in public health are working, often out of the public's eye, to ensure that communities are protected from harm and that everyone has the resources and conditions they need for health and well-being. We work on making sure the food is safe. We protect the water and soil. We prevent outbreaks and respond to outbreaks of bird flu and other diseases. We do work around sexual and reproductive health. We're essentially working for you 24/7 for the 10 million residents of LA County. But what the Republican Congress has done with their big, beautiful bill has put a lot of this at risk. About 50% of LA County's public health budget depends on federal grants and federal resources. And I'm going to leave it to Dr. Popat and Dr. Turner to talk about the Medicaid issues that this caused. But I want to focus a little bit for a couple minutes on what it means for public health here in LA County and for the district that Congressman Lieu represents. One of the things that's written in the big, beautiful bill is a cut to SNAP benefits, or otherwise known as food stamps. They're making a huge cut to this, and they're also cutting $16 million of grant funding that we in LA County Public Health get that help with SNAP education, with help with food stamp education. We work with over 20 contracted community providers in the community, and we reach over almost 200,000 individuals last year. We work with them to help them distribute over 1.68 million pounds of fresh produce to families in our communities who are facing food insecurity, and this is all now at risk. I also want to mention that, we're waiting for the appropriations process. So they passed the big, beautiful bill, and the House and the Senate will now determine the final federal budget over the next few months. And President Trump has already indicated that he wants to recommend that Congress decide to cut spending at the Centers for Disease Control and Prevention. That's one of the major public health funding agencies, by more than half, a 55% cut. If this happens with the spending bill, we at the LA County Public Health are looking at a huge loss of funding. We have over 1,500 employees funded by this, and over half of the funding we get from the federal government, which is about $900 million a year, we send out to community-based organizations and clinics and other groups that are helping us manage and ensure public health safety throughout our county. This is a huge concern. An example, one of the major grants we receive help us with public health emergency preparedness. This is our team that responds to and protects us from bioterrorism attacks. We have warehouses all around the place, all around the county, where we stockpile antibiotics, and we're monitoring the air at major events, sporting events, and other places, including the airport and many other locations, for these kinds of risks so that we can respond to them. The funding for this kind of work is at risk. The funding for the work we did in responding to the terrible wildfires, including the Palisades and Altadena wildfires, is at risk. Our public health department was involved in a lot of work related to assessing the environmental impact of those fires and helping ensure that people right after the fires were getting access to their medicines and making sure that they have the proper PPE to protect themselves when there was so much smoke and toxic debris in the environment. Another thing that's majorly at risk is our ability to test the ocean water. You all know in Representative Lieu's district, the ocean is so important, and every day public health is testing the water to ensure that it's safe, and we put out those daily reports that so many depend on to make sure that it's safe to go in the water. I'm going to finish with an example that is particularly concerning. One of the big things that we in public health do on behalf of all county residents is monitor and respond to disease outbreaks. You have heard about measles. Measles is one of the most contagious viruses out there. Measles can suspend in the air in a room for hours after an infected person has left the room. And anybody who comes into that room, if they are unvaccinated, can have an up to 90% chance of getting infected. The people that go into a room where there was a person with measles are referred to as contacts. We in public health, we work on ensuring that anyone who might have been in contact with a room or a person with measles has the proper information, guidance, and referrals to medical care to make sure that we can monitor them and make sure they're safe and healthy. Recently, there was a single case of measles here in LA County just a few weeks ago, and we found out there were at least 600 people or contacts that came were exposed to that person. We in public health deployed a team to go out and find everybody, contact them, assess their risk, and refer them for care if they needed it. This is just an example of the work that is at risk that we may not be able to do if we lose our funding. Public health work is really important, and it appears that it's potentially going to face a major cut. I want to finally finish with the fact that there was new guidance from the Health and Human Services from the federal department stating that there's going to be restrictions on undocumented residents to receive a range of federal services that they previously were allowed to receive related to health. This is a big problem. Public health work, by its very nature, is population-based, aimed at protecting and serving everyone, and a directive like this is not going to help. It remains true that diseases do not care about immigration status, and prevention is a population-level activity that happens across community settings. So if these kinds of things are implemented, it will be very difficult for us to protect everyone's health. And so we are so glad that you are here speaking with the Congressman and helping us advocate for the right decisions. I'm going to leave it there and turn it back to you, Congressman.
Thank you so much for your work on public health and everything you do to protect the community. Really appreciate it, and for being here today. Our next speaker is Dr. Mitesh Popat. He became Chief Executive Officer of Venice Family Clinic on December 12, 2022. He comes to us from Marin Community Clinics in Marin County, California, where he was CEO for 5 years. He has extensive experience as a community health executive, board-certified family physician, public health expert, and healthcare technology advisor. He also has served as an advisor to several health companies in the San Francisco Bay Area, and he has been a commissioner with Partnership Health Plan of California, a managed Medicaid health plan that covers 550,000 people in 14 California counties. Thank you so much for being with us today, and if you would like to say a few words, that'd be great as well.
Thank you, Congressman Lieu, and thanks to your office for your efforts on shining a light on this important topic and the effects that the big bill will likely have for years to come. Hopefully, the worst effects can be mitigated with further legislation in coming years, or maybe turned back. And so let me just start by telling you all a bit about Venice Family Clinic. We're a federally qualified health center. Our charge is to care for the most vulnerable people in our communities. These are our neighbors. These are our friends. These are our family members. These are people who are living with us in a community. And as Dr. Mahajan mentioned, it takes all of us to be healthy in order for an entire community to be well. We serve 45,000 patients from the Santa Monica Mountains to the South Bay. We have a long 55-year commitment to serving those most in need, and we believe that health care is a human right. And this bill is a big shot to the gut to that belief. Through the Affordable Care Act, 38 million Americans gained coverage, and we know that coverage saves lives. Coverage means that a person has a card in their pocket that pays for care, pays for services. That means cancer screenings. That means child visits for their child and vaccinations so we prevent those measles outbreaks that Dr. Mahajan was talking about. That means controlling chronic diseases so people don't have strokes and heart attacks that end up in the hospital costing society and the system millions and millions of dollars. We are committed to providing a comprehensive and holistic approach. That means providing medical services, social services, educational services to our community. And in so doing, we hope and aim to lift people up, lift people out of poverty, ending cycles of generational trauma that have existed for decades. And again, this bill is a real gut punch, not so much for us as an organization, that's not what keeps me up at night, but it's for our people, our neighbors, our constituents that are going to lose coverage. And it's projected that tens of millions will lose coverage somewhere. I've seen projections between 12 and 17 million people will lose coverage. We know people are especially fearful right now of seeking care, seeking services, and that is going to have an effect on delayed diagnosis, delayed care, cancers diagnosed at later stages. And that's a direct result not just of the big bill, but also the immigration enforcement effects, the rule changes that are being pushed, the PROWORA rule changes, which Dr. Mahajan alluded to, which is the change in what constitutes a public charge. Now that's on hiatus at the moment due to a federal court ruling for now. But the net effect of all of this seems to be that the federal government is waging a war on poor people and people of color. I can conclude no less based on these myriad of actions that have been taken. And to me, as a son of immigrants, it's unconscionable. It's un-American. It's not what makes this country great. At the clinic, we remain committed to the work. We will persevere through this. The arc of the moral universe is long, but it bends towards justice, as MLK said. 2 steps forward, 1 step backward. We remain adaptable. We've shifted aggressively to telehealth to meet people where they are, where they want to receive care. They are telling us they're afraid, so we'll reach using technology into their homes to provide care. We are calling people before every appointment with warm calls. This is tens of thousands of calls every month that we're making now to reach people in their homes, to talk to them with a real human, to ask them if they're okay, if they will come in for their medical care, their health care services. We're talking behavioral health services and dental care services and so many other things that we do at the clinic. And we're exploring other innovative models such as mobile services, drive-through services and things. Some of the things that we learned during the pandemic, might we deploy those approaches going now? So as a citizen, as a leader, as a friend, I'm deeply concerned about what this federal approach means in the coming months and years. And I thank you, Congressman Lieu, for being an advocate, an ally, and a leader in all that you are doing in Washington, D.C. Thank you.
Thank you so much for fighting a good fight every day and for your powerful words. Really appreciate it. We next have Dr. Andrea Turner. She is an accomplished healthcare executive with over 20 years of experience that includes legal and clinical work that focuses on civil rights and healthcare disparities within vulnerable populations. She is also a veteran with over 8 years of honorable service in the U.S. Air Force. Prior to serving as a CEO of Harbor-UCLA Medical Center, Dr. Turner was the Chief Operating Officer for Zuckerberg San Francisco General Hospital and Trauma Center, where she led and executed several important initiatives, such as the Patient-Centered Comprehensive Oncology and Imaging Center, seismic retrofit, and implementation and optimization of electronic health records. Thank you so much, Dr. Turner, for joining us, and please go ahead with your presentation.
Thank you, Congressman Lieu. This is such a privilege, and it was great to hear the 2 speakers ahead of me speak. And I do stand in the spirit of social justice, and this big, I call it the big burdensome bill, but it's the big beautiful bill, and it's really tearing our health systems apart. And so I see this as really a privilege to speak to everyone that's here on this call. I am the CEO at Harbor-UCLA, and Harbor serves a huge population. We are a trauma level 1 medical center as well, and so for us, it's we have primary care and specialty care, and like I mentioned, we have the trauma care as well. And our the way that Medicaid, the cuts to Medicaid will certainly impact us is beyond comprehension. As a safety net hospital, we take care of mostly the underserved, but it doesn't mean underserved is people that don't work, like the Republicans would like us to think, that folks that receive Medicaid are people that are just leeching and mooching off the system. That is absolutely wrong. These are hardworking people, the backbone of these United States. And so here at Harbor-UCLA, we are doing everything that we needed to do to take care of the community and beyond. And so, again, I just want to underscore the fact that Medicaid is not a luxury. It's not something that we took for granted. It's something that, as the doctor before me mentioned, it's truly the American way to take care of each other and the responsibility to do so. And so here we are, we're faced with the big, beautiful bill that is certainly having a direct impact on us. Here at Harbor-UCLA, we treat chronic illnesses like the other speakers mentioned. And again, we didn't talk much yet about the mental health and rehabilitation, but those are some of the things that we do here, as well as transplant care that the patients that we care for would need and would receive. And then we take patients with cancer, and we're certainly happy with our turnaround times, which competes with any other health system around. We see approximately over 600,000 primary care visits, and we see over 100,000 in our ED annually. And then we have many other specialty cares that we support. As you all may know, is that Harbor-UCLA is one of the facilities under the Department of Health Services. And so we took pride in taking care of our patients, irrespective of whether or not they could pay when they came in for like trauma services. And then, of course, we have empaneled lives that we care for in an excellent manner. And so here comes this big, beautiful bill that literally just slashed that dream and kicked us in the gut and, just basically it put us in this space. And I just want to say that for us at DHS and at Harbor-UCLA, we are also looking at innovative ways to ensure that the care to our patients do not suffer and that we will be able to do what is right by our patients. But that's going to be exceptionally difficult. Again, the slash to us is in, almost $800 million annually, which, again, that is an enormous amount of money. But when we're taking care of a patient population that needs us, we have to be very, very proactive. And so making sure that we care for the patients before they have to come to the ED. And again, as I don't know how many people are on the call, but if you can remember before the ACA that the ED was practically overran by patients. And so this way was the most responsible way when we got the ACA bill passed. And now to see us going backwards. It's definitely not Make America Great Again at all. And so it is truly having the most negative impact that in my lifetime, that I've ever seen. And so as we have this discussion, and hopefully we'll have questions, and again, my position is for us to dismantle this big, beautiful bill, and for us to do everything we can to ensure that Congress actually stands up to the president and do their job to ensure that this does not happen to the people that we serve. Back 20 years ago, they asked us to lead from the front. This was the mandate for healthcare, to move from the rear and lead from the front. And now that we started to do it, and we started to see so much happening in our communities that was positive, and again, we aligned with the mission of caring for our communities, and now this big, beautiful bill is to send us back predating the ACA, and that we cannot stand for. And so, Congressman Lieu, I am so appreciative of you and the fight that you're doing, and I want you to know we are with you in every way that we can. And I know I'm joined with two others that are also with you. And so, I can't say anything that no one else has said already, and so I don't want to necessarily keep repeating it, but just to know that we're here to do the work and to be accountable, and we need to hold Congress equally accountable. Thank you so much.
Thank you so much, Dr. Turner, for your leadership at Harbor-UCLA Medical Center and for your presentation. Really appreciate it. And now, happy to answer any questions from the telephone town hall audience.
Yes, absolutely. Thank you all so much. Again, you are live with your Congressman Ted Lieu and special guest. Again, if you have a question, don't hesitate to press 0. We have lots of questions lined up here, and it looks like first up tonight, we have a question from Jennifer in Harbor City. Jennifer, thank you so much for joining our forum. Please go ahead with your question.
Hi. I'm looking at this from two different serious questions. I guess I'll be selfish and say my first one. I want to keep my son alive, and I'm afraid what's happening is going to cause his death. He's autistic, and he receives in-home supportive service. He's had cancer, sepsis, blood clots. On Monday, we entered the hospital. He's going to be here for a week, and I am scared to death that the in-home supportive services program is going to be defunded, that the social workers we work with are going to lose their jobs, and we're going to lose what's keeping him alive. He has Medicare and LA Care, Blue Shield Promise, and he's extremely ill. And I've gone so far as to ask people, what kind of job do you think I could get with my son with me? And I can't pick fruit, like I think the president thinks, well, all the people, we're going to take all the immigrants out and all the sick people can go pick the fruit. He would die within hours from being out in the heat like that. So he can't stand there and watch me pick strawberries. But it's that bad that I think about things like that. So my first question is he in imminent danger of losing his in-home supportive services? How ready to jump in and be proactive and pull a miracle out of a hat do I need to be? Or is that not going to happen right away?
So thank you so much for your question. My district staff is here as well, and so after your question, I'll also have them get in touch with you and see what we do specifically for your situation with your son. Part of IHSS also has to deal with state-level funding, and so I know that the governor and state legislature are also very concerned as well about these cuts and what California could do to try to mitigate some of them. I will, specific to your situation, because it gets somewhat complicated, I'll have my staff follow up with you, but I want to see if any of the three speakers might also want to chime in on this specific issue of IHSS. If not, I'll have my staff follow up with you specifically on your case. I'm sorry, go ahead.
Oh, sorry about that, Congressman. This is Dr. Mahajan from County Los Angeles. I just want to acknowledge your story. Our hearts go out to you, and thank you for being such an amazing caregiver to your son. And we in the County of Los Angeles, I know that the County Board of Supervisors also deeply value the IHSS program and are big supporters of it, and are also going to do their best to join Congressman Lieu in advocating to protect it.
Thank you. If you stay on the line, I'll have my district staff follow up with you.
Absolutely, Jennifer. We'll get that information and definitely reach back out to you. Let's go ahead and get to another question we have here coming in from Jane with us in Santa Monica. Jane, thank you so much as well for joining us. Please go ahead with your question.
Hi, Congressman Lieu. I just want to thank you very much for all that you do. And my question is, do you think Social Security is going to go away in this presidency?
I do not think so, but it does take all of us fighting back. I was very troubled today by the Treasury Secretary essentially saying that they are on the road to privatizing Social Security, which is a horrendous, horrible idea. And I know that the Trump administration has already made cuts, and that's affected services that the Social Security Administration can provide. So people have, you read about cases where people have very long wait times when they try to call in to Social Security Administration. And it is something we're trying to fight back against. So I hope it doesn't, but it does take all of us fighting back. And the comments today by the Treasury Secretary were deeply concerning. So when we go back in September, just so you know, I'm a co-author of Representative John Larson's Social Security 2400 bill that would strengthen Social Security, and we're going to see if we can try to get some Republicans to support that as well.
All right. Well, Jane, thank you so much for joining our forum here tonight. Again, if you want to get in line with the question, you can still do so by pressing 0 on your phone keypad. I did want to give just a last reminder as well that if you wanted to go ahead and sign up for the Reps e-newsletter, you can do that while we have you on the phone tonight. All you need to do is press 7 to provide an operator with your best email address so that we can keep you updated in the future. Now, with that, I do want to go ahead and read our next question here from, looks like we have Karen in Redondo Beach. She's wanting to know, what about funding for veterans and funding for the homeless? Will this all be affected by the cuts happening in funding that we so desperately need?
Republicans in both the House and Senate have made cuts to veteran services. The Trump administration has also done that. It is not a good situation. They're making sort of cuts across the board and to many agencies, including the Department of Veterans Affairs. So we're trying to fight back as hard as we can. We have the appropriations process coming up, and at the fiscal year federally essentially ends at the end of September. And so when we come back in September, we're going to be dealing with all these appropriations bills. And I know that Democrats are going to hold strong on all their appropriations bills that fund services for veterans. And hopefully we can get, again, some Republicans to stand with us. We only need 3 Republicans to join us, and we can stop any of these drastic cuts.
All right. Well, thank you so much, sir, and thank you again for that question from Karen. We do want to take a minute here to run our first survey question. So everyone listening in, if you would, go ahead and vote by using your phone keypad. The Congressman wants to know, what do you think is the most important role of Medicaid in our community? You can press 1 for providing health care for low-income families. Press 2 for covering long-term care for seniors and people with disabilities. Press 3 for supporting hospitals and clinics in underserved areas. Or you can press 4 for all of the above. So again, what do you think is the most important role of Medicaid in our community? Again, pressing 1 here for providing health care for low-income families. Press 2 for covering long-term care for seniors and people with disabilities. Pressing 3 for supporting hospitals and clinics in underserved areas, or pressing 4 for all of the above. And thank you all so much for your feedback here. Let's get to this next question from Mary with us today. Again, Mary wants me to read her question. She's asking, what can we do to stop all of this? We can't wait until the midterms. What is the strategy? Is there something we can rally around? What do you advise?
That's a great question. I'm going to paraphrase James Madison, who in 1788 essentially said, it's the virtue of the people that saves a democracy. So the 200 some Democratic members of the House are going to fight and try to do everything we can to slow down or stop this administration. But it's really going to be the American people that rise up that's going to slow down or stop this administration. And I thought the No Kings protests were amazing. It was the largest protest in U.S. history. And going in town halls and rallies and marches really does make a difference. And public pressure does make a difference. I do note, for example, that the administration did bring back Kilmer Garcia from El Salvador. They also did charge him with a crime or crimes in the United States, but at least he can defend himself. He has due process in these federal courts. The administration did that because of public pressure. We also saw that the administration recently released a whole bunch of funds for education that they had frozen and stopped. And again, they were doing that because of public pressure. And also the court rulings have been helpful. Over 200 cases have been filed against this administration, stopping a number of executive orders. There's been over 180 injunctions issued. So in many of these cases, the administration is losing. And that is also helpful to performance and strength of our judicial branch. But really, it is the American people. And I just want to also highlight what Abraham Lincoln said about public sentiment. He said that public sentiment is everything. With it, nothing can fail. Without it, nothing can succeed. So understand your own power to shape public sentiment. So in addition to speaking up and speaking out, think about writing letters to the editor. It does turn out a number of people do write letters to the editor, but they often come from the same people. So when you start writing in, you can start changing hearts and minds. Social media is free. If you write an interesting post, maybe you can affect a voter in Wisconsin or in North Carolina or in the Central Valley of California. And that is how we essentially slow down or stop some of the worst excesses of this administration.
Sir, thank you so much. And let's go ahead and get to another question here from Joanne with us on the line in Marina Del Rey. Joanne, thank you so much. Please go ahead with your question.
Hi, thank you everybody on this call. I'm wondering if there is anything that we can do in Congress to enact a law to require that ICE agents be unmasked and a way to protect, immigrants and citizens. Take it away, Congressman Lieu. I am really concerned about what's going on in LA.
Thank you for that question. I support a law that would require ICE agents to be unmasked. I know California is also working on California-specific law as well. And what we see is the Department of Homeland Security engaging in a number of unconstitutional actions. So in addition to the masking issue that you raised, I also note that in order for law enforcement to arrest someone, they need to meet a standard called probable cause. In order for them to detain someone, they need to meet a standard called reasonable suspicion. Race and ethnicity cannot be the basis for either of those two standards. And so when ICE goes to a public park in Los Angeles, or if they go to a Home Depot and just start rounding up brown or Asian people, that is unconstitutional and it's illegal. That is just straight up racial profiling, and there are now lawsuits that are being filed, and a federal district judge, in fact, has basically said that these mass raids where they don't have a judicial warrant are in fact unconstitutional and illegal. So my hope is that it gets appealed, that ruling will be upheld. And so I've been calling repeatedly for the Department of Homeland Security to follow the law, follow the Constitution, and the judicial branch in many cases are ruling against the administration. So I appreciate what you asked, and I agree with your question.
And Joanne, again, thank you so much for bringing that question live tonight. Let's go ahead and get to another question here. I do want to give another reminder here that we've cleared that queue for emails. So again, I just want to encourage folks who have not done so already to press 7, provide an operator with your email address to receive updates moving forward from the Congressman's office. So again, this is going to be one of the best ways for you to stay current. And right now, I see many more of your neighbors are currently taking advantage of this option. So again, go ahead, press 7 right now to sign up for the Reps e-newsletter. You're not going to want to miss out there. Let's go ahead and get to another question from Dennis with us in Torrance. Dennis, thank you for being patient here with us. Go ahead with your question.
Yes. First of all, I'm a member of the organization National Active and Retired Federal Employees Association, and I want to thank you for your strong support that you have shown our federal and postal workers over the years. Shout out to the participants from Harbor-UCLA. My mother is retired, 33 years. She was the medical director's secretary for 33 years at Harbor-UCLA Med Center. My question would be, as we go into appropriations and we looked at all the cuts and the firings and what have you for the federal workforce, do you see anything in the appropriations coming up in September that would affect the federal employees' health benefits program or the Postal Service health benefits program?
So thank you for your question. First of all, thank you for your service. And also, I just want to say a few words about the post office. The Trump administration wants to privatize the post office. That is a horrendous, horrible idea. And I just want people to understand that if you made FedEx or UPS send a letter anywhere in the United States for the price of a postage stamp, they would go bankrupt. So unless you want to pay $20 to mail a first-class letter, it is going to be insane to privatize the post office, because the post office exists to make sure that every American can get mail, whether you live in Los Angeles or you live in the middle of nowhere in Nebraska. And only the post office is able to do that. If you made any private sector company try to do that, they would not stay in business. And so I just want people to understand that the post office exists for a whole different reason, which is to provide mail and product delivery to anyone in America. And there is simply no other way to have a private sector company do it that wouldn't hurt a lot of Americans, because they're going to fail at it. Now, specifically on your question, I am not an appropriations committee, so I will have my staff look into your specific question and we'll get back to you. But again, I just note that it's such a thin margin in the House. If we can just convince 3 Republicans to stand with us, and there are actually a handful of Republicans that are fairly strong supporters of the post office, the Postal Service. So if we just get a few of them to stand with us, then we can stop some of these cuts. And so I'll have my staff get back to you on your specific question. And I don't actually know if a determination has been made yet, actually, because the Republicans are still they're very chaotic in their caucus, so they're still trying to figure out a number of their appropriations bills.
All right. Thank you so much, Dennis. And I do want to go back to that first survey question that we ran here, sir, and just ask for your thoughts on these results. And I do want to remind folks that we did ask, what do you think is the most important role of Medicaid in our community? Those options being providing health care for low-income families, also covering long-term care for seniors and people with disabilities, also supporting hospitals and clinics in underserved areas. And sir, with 82% of the listening audience, they voted for all of the above. So any thoughts on these results here?
That's very helpful to know. And I just want to note that the way healthcare works, because in the United States, we don't let people die if they show up at a hospital. The way healthcare works is if you don't have health insurance and you show up in the emergency room, guess what? You're still going to get treatment if you're very sick. And then that cost gets passed along to everybody else. So when you make these deep cuts to Medicaid and people no longer have health insurance, people still get sick, and so they're still going to need treatment. So then they end up going, for example, to Harbor-UCLA emergency room. And Harbor-UCLA is going to treat them as they should, because we're in healthcare trying to save lives. And then that cost then gets passed along to people who have health insurance, and it gets passed along to hospitals, and it gets passed along to everyone else in the healthcare system. So by making these big cuts to Medicaid, it's just going to increase everybody's health insurance costs. And I note that the big ugly law also makes cuts to the ACA, so people who are on the Affordable Care Act are going to see their premiums rise. And the way the bill is structured, it's going to cause $500 billion in cuts to Medicare as well. So this is all around a huge blow to healthcare, which then increases everybody's costs.
All right. Yes. Thank you so much, everyone, again, for your feedback here in that survey question. Let's go ahead and get to another question here. Let's hear next from Karen with us in LA. Karen, thank you so much for joining us here. Go ahead with your question for the Congressman.
Thank you, Congressman Lieu. I really want to thank you for speaking out about the large cuts to health care. I am frustrated that other Democrats are not loudly criticizing the cuts and what the results will be, especially to research institutions that are studying cancer and Alzheimer's and other diseases, and also that we have a large shortage of doctors in this country. Yet because of these cuts by the current administration to the research hospitals like UCLA, USC, Duke University, and all across the country, there are now hiring freezes for new doctors. And right now, this month, the current group of medical and surgical residents are finishing their programs and looking for jobs, and we need them, and yet they are having difficulty finding jobs because of the freezes at these hospitals due to the cuts in funding.
Thank you so much for your question, and I completely agree with everything you said. These cuts are going to have a devastating effect not just to patients, but also healthcare providers. And specifically to your question that you raised about sort of freezes and doctor shortages and so on, I was thinking maybe Dr. Turner, if you have any thoughts you could shed on that as well.
Thank you. You're absolutely right. And again, just echoing the same things that we've said before, these cuts are not just to one sector of the population. It spreads across it. For us, it's really about the need, and we are on a hiring freeze. However, there are exemptions for that. And so we're still looking at areas that we need physicians in. And to the caller's point is that you're absolutely right. We have a shortage of doctors, especially primary care doctors. And we need them. I was actually watching something on CBS last night where they're looking at doing a fast track program for primary care physicians. So yes, we need them. And I think for us at Harbor-UCLA, we are definitely keeping our doctors and looking for to fill positions that we have vacant. So as the Congressman said, our duty is to care for our patients, is to care for anyone that comes to our doors. We are going to continue to do that, and we're going to work hard to ensure that our communities still remain healthy. But that shouldn't stop us from fighting to ensure that we have a healthier community and that we stop this bill from taking hold. Like, that's something that should actually get us fired up, honestly, to fight that. but we will be here. We will take care of our patients, and, we'll continue to provide the excellent care that we're known for. Thank you.
Thank you.
Yes, absolutely. Thank you both. And we have reached our allotted time here tonight. And before I do hand it back over to you, Congressman, for some final thoughts, just wanted to share that if your question was not answered, we do encourage you to leave us a voicemail message. Once this call ends, go ahead, leave us your name and your best contact information when leaving that message. Also, you can feel free to visit the rep's website at lieu.house.gov for any additional information that you may be looking for. And we do appreciate everyone's time. So with that, Congressman, any final thoughts?
Yes. So I'm going to have our three speakers maybe briefly give any final thoughts that they have, and then I will conclude this telephone town hall. So I'll start with Dr. Mahajan, if you have any final thoughts.
Just a very big thank you to you, Congressman, for your excellent advocacy, and to all the callers who are educating themselves and learning more and giving us insights that they know about. I believe in the power of public action. Just a small, quick example. We know that, a few months ago, the NIH, the National Institutes of Health, had announced that they were canceling the Women's Health Initiative. This is as many of you know, decades-long research project that is sorely needed to help us provide insights about women's health, about cancer, and many other things that impact women because women have been systematically understudied. They announced this, and there was such a public outcry against it that they reversed this decision and resumed funding the Women's Health Initiative. So thank you for being here. Please keep spreading the word.
Thank you so much. Dr. Popat?
Yeah, thanks again, Congressman Lieu, and to all the fellow speakers and callers and community members. I would just encourage us to stay fired up, to stay engaged, and to engage in collective action and advocacy. It's going to be really easy to fall back and become a bit complacent and allow this to just become the new norm. But I don't think this is normal. We are the only developed country to not provide coverage to every person in their country. And so I think we have to keep that as the North Star and try to have care provided in the right way, in the right place, and not in the emergency departments, and to try to work in a preventive fashion and to make sure to ensure we have healthy communities. So thanks again.
Thank you so much. And Dr. Turner?
Thank you, doctors, and thank you, Congressman Lieu, and for every participant here. I think I've said it all so far, but the last thing I want to say, and I just want to echo this again and again, we cannot be complacent. We cannot let this beautiful country that we work hard in and that we work hard for our communities and that we celebrate our communities and allow this to happen. We have to stay fired up. We have to push and push and push down and push past and push through. This is something that we cannot allow to take hold. It is going to ruin our health system. And so we need to stand and we need to fight. And I'm so grateful for you, Congressman. I think this is a fight that we must win. And so for everyone that's participating here tonight and beyond, it is important that we take these steps to push through and push down and push past it all. So I appreciate this time, and I wish us all the best. And again, for us to continue to be fired up and stay fired up. Thank you.
Thank you so much, and thank you to the wonderful speakers for fighting the good fight every day, for your tremendous public service. And I just want to tell the participants, everyone participating today on this telephone town hall, that speaking out matters, that advocacy matters. The president, according to a Gallup poll that came out recently, is at 37% approval. It's one of the lowest approvals of any U.S. president. The only U.S. president to have an even lower approval than that was Donald Trump in his first term. And so people are paying attention. People see when there's advocacy and people speaking out, and when their neighbors talk to them, when their coworkers talk to them, when they read things on social media or in the newspapers. So please continue your advocacy and speaking out, and that is how we're going to turn our country around. Thank you so much for participating, and I hope everyone has a very blessed day. Thanks again. Bye-bye.